ambayo pia nitakuja kuzindua.
Mtazamaji, kwa taarifa hiyo tukuelekeze sasa kwenye kongamano la ugatuzi, kongamano la 11 la ugatuzi ambalo linaandaliwa hii leo kuangazia maafikio na changamoto ambazo zinakabili ugatuzi humo nchini. Kaunti zikitarajiwa kupokea takriban shilingi bilioni 474 mwaka 2025, takriban shilingi bilioni 405 zikiwa kwenye kapu la ugavi sawa wa rasilimali. Kongamano hilo linaendeshwa na kuongozwa na Ahmed Abdullahi ambaye ni mwenyekiti wa baraza la magavana. Tusikize.
For the year, and of course getting to understand the milestones and the gains that we've achieved for the last 1 year. You will agree, after the state of devolution is read, that we've made considerable progress in the last 13 years, and would want to appreciate each and every partner that has worked with us this journey to make the contents and the premises of devolution a success. Thank you very much, and allow me now usher in the whip of the Council of Governors, His Excellency Governor Stephen Sang, to proceed with the program. Thank you, Excellency.
Thank you very much, our CEO. Good afternoon, everyone. Our apologies that we are starting late, but since we have to manage time so that we have our chair read the State of the Devolution address in good time for the live coverage. So welcome, everyone. We will just have about 2 or 3 remarks before we allow the chair to read his to address us on the State of Devolution address. And we'll start with remarks on behalf of development partners. Mr. Sebastian Groth, but being represented by the Deputy Head of Mission from German Embassy, Karibu sana. Alexander, Karibu, Your Excellency.
Your Excellency, CS for Health, Excellency Chairman of the Council of Governors, Excellencies Governors, PS for Devolution, PS for Trade, Chair of IGRTC, dear partners, dear friends. It gives me great pleasure to join you today at this year's annual State of Devolution address. I thank you sincerely for the invitation to this important forum and for the opportunity to engage with you, the champions on Kenya's devolved system of governance. Your Excellencies, over the past decade, devolution has profoundly reshaped governance in Kenya. It has brought government closer to the people. It has created space for citizen engagement, enabled counties to respond more directly to local needs, and contributed to reducing historical inequalities. From healthcare to infrastructure and agriculture, the impact of devolution is visible and tangible. Let me commend you, the county governors and your teams, for the leadership you have demonstrated in driving this transformation. I also wish to applaud the Council of Governors for fulfilling its critical mandate as a unifying voice and coordination body, ensuring that county-level achievements, best practices, and lessons learned are not only documented, but also shared, scaled, and strategically fed into national dialogue and policy processes. In Germany, we look back on a long and rather successful tradition of federal and devolved governance. We know from our own experience that decentralization, when well managed, not only deepens democracy, but also strengthens national unity and promotes equitable development. This is why we are pleased to co-chair the Devolution Donor Working Group with UNDP, and why devolution remains a central focus of Germany's development cooperation in Kenya. Through our implementation organization, GIZ, and jointly with the European Union, the German government supports the Strengthening Good Governance program, which is implemented in 15 counties. This program promotes transparency, anti-corruption, sound public financial management, and performance-based service delivery, not as ends in themselves, but as pathways to greater public trust and improved living standards. At the same time, we are also supporting the development of much-needed infrastructure at the county level through our development bank KfW, with programs such as drought resilience in northern Kenya and the financing locally led climate adaptation program. We are helping counties to identify and finance bottom-up solutions to tackle climate change and help local farmers. However, one challenge we are continuously facing is the delayed transfer of funds from the national to the county governments through the county government additional allocation bill. Since the delayed transfer of funds leads to problems in project implementation, additional costs, and ultimately the risk of project cancellations, let me ask you for your support in solving this issue. I was informed that the National Treasury is proposing an amendment to the Public Financial Management Act so that funds are for development projects will be excluded from the allocation bill and adopted separately. I hope you will support this proposal. Ladies and gentlemen, we strongly believe that devolved governance can fulfill its promise only if institutions are accountable and systems function transparently and efficiently. However, while devolution has delivered important gains in it is not a guarantee in itself. Without effective performance management, service delivery may falter. Without robust financial oversight, resources may not reach where they are most needed. Without citizen participation and trust, democratic legitimacy may erode. As we take stock of the journey so far and chart the course ahead, let us remember, devolution is not an event, it is a continuous process of building capable, responsive, and trusted institutions. It is about the social contract and the daily work of making government work for the people. It is important to recognize that making it work, truly work, is a joint responsibility that lies with political leadership and institutions. Governors, county assemblies, administrative officers, civil society, and development partners all have a role to play in ensuring that devolution delivers on its promise. The demand for accountable, responsive, and transparent governance is growing, and citizens are watching closely. It is not enough to have plans and frameworks. What matters is the quality of implementation and the integrity of constitutions and those serving those institutions. This moment calls for continued commitment, stronger collaboration, and a shared determination to make good governance a lived reality on all levels, at the national level, but also in the counties. Ladies and gentlemen, creating accountable and transparent government institutions serving for good governance on all levels are legitimate core requests of the protesters that we currently see in the streets of so many cities around Kenya. You as county leaders are very close to the lives of those people. Your efforts in this regard will make a difference to those who are aspiring for a better future. Germany sees peaceful protests as an important element of democracy. Vandalism, but also brutal police violence, however, will be harmful to all sides and create a picture of Kenya that is detrimental to business and investments. Allow me once again to express my appreciation for the invitation extended to the German embassy. We are looking forward to this year's devolution conference that will take place next month in Homa Bay County. The event's theme, For the People, for Prosperity, captures the essence of devolution as it highlights the centrality of the Kenyan people in devolution, the key aim for devolution to foster a better life for the citizens, and its strong ambition to achieve a more equitable and just society. We are honored to walk this path with you and will continue to support you in implementing Kenya's vision of strong, accountable, and citizen-centered devolution. Asanteni sana.
Another round of applause for our development partners. You have been very supportive to the work in our counties. I now want to give 2 minutes to the Principal Secretary in charge of State Department of Devolution, Mr. Michael Lenasalon, to come and make his remarks. Karibu sana. And this is his first time. Karibu sana.
Thank you, Your Excellency. I had a long speech, but I was told I don't have time, so I will summarize. The Chair, Council of Governors, Governor FCA Ahmed Abdullahi, Governors present, Cabinet Secretaries, Deputy Ambassador Germany to Kenya, Alexander Fiali, Principal Secretaries present, the Chief Executive Officer, Council of Governors, Mary Mwiti, Senior Chief Officers, CECs of county governments, senior officials from the national government, ministries, departments and agencies, development partners, civil society representatives, distinguished guests, ladies and gentlemen, good afternoon. It is my honor to stand before you today as we reflect on our collective journey in advancing devolution, the most transformative promise of our Constitution. Over the past year, we have witnessed counties rise as engines of opportunity, inclusion, and service delivery. On our progress that we have made, the counties have been on the forefront. Counties now manage over most of our critical services, from healthcare to agriculture, bringing government closer to the people. They have also catalyzed economic growth. Initiatives like that we are
Na mtazamaji, tuwie radhi kwa mgando huo wa picha. Ni kongamano la 11 la ugatuzi ambalo linaendelea sasa hivi kutathmini miaka 11 baadaye. Je, kuna lolote la kujivunia hususan kuambatana na ugatuzi humo nchini? Kwa sababu mara si mara wamekuwa wakizungumza kuhusu uhaba wa rasilimali hususan fedha katika kaunti mbalimbali, lakini tunatarajia kwamba kaunti mwaka huu, katika bajeti ya mwaka huu, zitapokea takriban shilingi bilioni 474, takriban shilingi bilioni 4.5 zikiwa kutoka kwenye hazina ya ugavi sawa rasilimali, na kaunti za Nairobi na Nakuru zinatarajiwa kupokea mgao mkubwa zaidi. Na tunatarajia kuwasikiza pale viongozi wa baraza la magavana wakiongozwa na Ahmed Abdullahi ambaye ni mwenyekiti wao, kutoa kauli zake kuhusiana na hali halisi katika kaunti, uwekezaji unaohitajika ili kaunti ziweze kujiendeleza, na ni vipi ambavyo wanaweza kukabiliana na changamoto ambazo zimekuwepo. Mojawapo ya changamoto ambazo zimekuwa zikikabili kaunti ni sekta ya afya. Kwani mara si mara tumeshuhudia wahudumu wa afya katika kaunti wa Kigoma kutokana na kutaja kutotekelezwa kwa mikataba ya makubaliano na hali ngumu katika kaunti. Je, swala hilo linashughulikiwa vipi hata wanapotathmini mgao wa fedha ambazo zinaelekezwa katika kaunti? Kumekuwa na mvutano hapa na pale. Tuliona wale wahudumu wa afya ambao walikuwa chini ya mpango wa huduma za afya kwa wote UHC wa Kigoma kwa siku nyingi tu, na Wakenya wengi wameashiria kuhangaika wanapotafuta huduma za matibabu katika hospitali za kaunti, wakisema vile vile kando na uhaba wa madaktari kumekuwa na changamoto ya kupata dawa katika kaunti. Je, swala hili limeweza kushughulikiwa? Vile vile wengi wametaka miundo msingi katika kaunti kuboreshwa. Je, hali imefikia wapi kufikia sasa? Vile vile swala lingine ambalo limeibua sintofahamu, unakumbuka mahojiano yalifanywa na raia kuhusiana na ile basari, ufadhili wa masomo. Je, unastahili kuwa chini ya usimamizi wa wabunge au ni serikali za kaunti? Umma ulishirikishwa pakubwa katika kulijadili swala hili, na wengi wakipinga kauli ambazo zilitolewa na baadhi ya viongozi za kutaka kufutuliwa mbali kwa hazina hiyo ambayo inatolewa ili kuwawezesha wanafunzi kutoka familia maskini kuendelea na masomo yao. Je, hali imefikia wapi? Ni mojawapo ya masuala ambayo tunatarajia kwamba yataweza kushughulikiwa. Swala jingine ambalo tunatarajia kwamba litaweza kushughulikiwa ni kuhusu mpango wa lishe shuleni. Vile vile swala kuhusu ufisadi linakabiliwa vipi katika kaunti, kwa sababu wengi wanasema tatizo si kwamba hakuna mgao wa fedha katika kaunti. Tatizo kubwa ni ufisadi katika kaunti. Ni vipi na mapengo ambayo yanasababisha kufujwa kwa fedha na matumizi mabaya ya fedha za kaunti unaweza kukabiliwa. Orodha ni ndefu tu ya masuala ambayo Wakenya wanatarajia kwamba yataweza kushughulikiwa. Vile vile bajeti za kaunti zimefikia wapi? Tuwasikize.
I have a lot of respect for and many other people. I think I am here just here to join. It's a very important occasion. The State of the Nation's address on devolution. Devolution is an imperative. Devolution is not a choice. It's a constitutional imperative. It's a chapter in our constitution. Devolution has worked. It has its challenges like many other. And speaking from health, for me to deliver as the Minister for Health on the universal health care, the Taifa Care, where over 25 million Kenyans have registered on our Social Health Authority portal, I need the leadership of the devolved units, the governors led by their chair, the secretariat. And I want to say that on behalf of the President, this administration, we are there to make sure that at both levels, our independent commissions, we all work for the people of Kenya, and devolution must work. And with health, it's working. This morning we had a very good meeting, and I want to ask all other colleagues of mine who have functions that relates them with the counties. You have no choice. There are no silos. You need to come to Delta House, sit with the leadership, sit with the secretariat, for us, all of us, to deliver to the people of Kenya. Chairman and Excellencies, thank you very much for the support you have given me personally and my team and my two PSS who are here, and recognize the other PSS. You have given us, our team, immense support, collaboration, partnership to deliver affordable, accessible, and equitable healthcare delivery system that works. Thank you very much.
Waziri Duale, it is too early to make an assessment and a judgment on how you are doing it, but whatever it is that you are doing, whichever way you are doing it, keep doing. I think it is working. It's now my opportunity to invite our Vice Chair, Daktari Mwalimu Mutai Kaiga, to come and make his remarks and in turn invite the chair. The man from the mountain, karibu sana.
Thank you very much, our whip. The chairperson of the COG FCPA, Ahmed Abdullahi, I'm excited when I see you, and this should be a message that the COG believes that one day someone from Northeastern will be a president in this country. Honorable C.S. Duale, Excellency Governors and Deputy Governors, County and National Government Representatives, Development Partners, distinguished guests, ladies and gentlemen. It is indeed an honor for me to be here today as we celebrate 12 years of devolution. The State of Devolution Address is indeed a significant event in the devolution calendar. This year it comes at a time when our country is in a deep reflective mood, when we are called to remind ourselves about the democratic tenets that form the foundation of our Constitution. If we can, for 1 minute, have our minds revisit Article 174 of the Constitution, we will appreciate that the architects of the devolved system of governance were desirous that public goods, healthcare, housing, education, water roads, and others are available to all Kenyans of all ages and all tribes. For 50 years, we implemented a system that propagated political and socio-economic marginalization and isolation, leaving many sections of the Kenyan population disgruntled and neglected. Devolution is envisaged as the cure for this. And when its objectives are zealously implemented, we will witness remarkable transformation in our communities. Therefore, as my able chair reads as the SODA for the financial year 2024-25, I hope that you will listen keenly, and at the end of the address, individually and corporately, we shall recommit ourselves to the promises of devolution as enshrined in the Constitution. The report we are about to give will be marked by county achievements documented in the last 1 year. Nevertheless, these successes have not come without their share of challenges. Delayed disbursements, policy and legal clawbacks, inadequate capacity in some devolved sectors, governance inefficacies are some of the teething problems that face devolution. But let it be known that we are not perennial complainers. We are only devotees of devolution. We are true believers of devolution, and we plead with many to join us. And however, despite the challenges, we are not dismayed. We are not burying our heads in the sand. We as county leaders, we are taking bold steps to correct the mistakes and steer the devolution ship steadily. Flowing from the above, it is important that I remind all of us here today, and as the chair of Devolution DEVCON 2025, the conference which will be held in the County of Endless Potential, that is Homa Bay, from the 12th to the 15th August, as we seek to have a candidate discourse on the place of devolution in the realization of equity, inclusion, and social justice. Ladies and gentlemen, I invite all of us to join the devolution family in that conference. It's going to be a wonderful conference, and I plead that you all come. Having said that, ladies and gentlemen, kindly join me as I welcome, on behalf of the COG, our able chair, FCPA, Ahmed Abdullahi, the governor of Wajir, and an able chairman to come and address us. Welcome, my chair.
The Vice Chair of the Council of Governors, Excellency Governors here present, our brother the CS for Health, the Principal Secretaries, CEO of Council and staff, development partners, members of the press, fellow Kenyans. Good afternoon. On behalf of the Council of Governors, I am pleased to deliver the 11th State of Devolution Address. We abbreviate it as SODA. As the county governments steer their 12th year, the COG recognizes the importance of retracing our steps back
to the painful and spirited journey that birthed the current constitution. The Bill of Rights and devolved governments remain the two most significant chapters in our constitution. The State of Devolution Address comes 1 month before we convene in Homa Bay County for the Devolution Conference 2025. The conference theme, for the people, for posterity, for the people, for prosperity, rather, devolution as a catalyst for equity, inclusion, and social justice. Couldn't have come at a more relevant time in our country. I make this address while fully acknowledging the voices of Kenyans calling upon the governments at the national and the county level to step up and deliver on the promise of our Constitution. Before I delve into the address, on behalf of my colleagues, it's with profound humility that I recognize all Kenyans who have lost their lives through the recent protests. To the bereaved families, poleni sana, and may the sacrifices of your loved ones not be in vain. We also sympathize with all the innocent Kenyans who lost their lifetime investments through the arson and violence that accompanied the protests. Whilst appreciating that peaceful protests are a constitutional right, we condemn the violence and robbery by goons taking advantage of the protests. And now, on behalf of the Council of Governors, on behalf of all county governments, I highlight the strides made by the county governments in the financial year 2024-2025. Fellow Kenyans, on finance, in the fiscal year 2024-2025, county governments projected total revenue of 600.69 billion, with Kenya shillings 222.2 billion being 37% allocated to development, and Kenya shillings 378.49 billion, 63% for recurrent expenditure, meeting the legal requirements under the Public Finance Management Act, PFM Act, to allocate at least 30% to development. The revenue was drawn from four main sources: the equitable share, Kenya shillings 418.26 billion, which included arrears from the previous year, additional allocation from the national government and development partners, commonly referred to as conditional grants, was 66.35 billion, on-source revenue projections, including facility improvement funds, was 87.11 billion, and unspent funds from the fiscal year 2023-24 was 28.9 billion shilling. Those are funds that are rolled over. On allocations, as of 30th June 2025, a total of 354.33 billion had been disbursed to county governments as equitable share. However, as I make this address, I confirm that the county governments have received the full equitable share totaling 400.26 billion and 16.27 billion for additional allocations from development partners. During the first 9 months of the fiscal year under review, counties raised 45.91 billion in on-source revenue, achieving 53% of the annual target and improving by 11% from the previous year. Counties such as Tana River, Garissa, and Narok performed particularly well, with Tana River exceeding its annual target by 72%. However, pending bills remained a significant concern. By 31st of March 2025, total pending bills stood at 172.51 billion, with Nairobi County alone accounting for 115.69, which is 70% of all pending bills. The persistence of pending bills was mainly attributed to delays in the disbursement of funds by the National Treasury. In the health sector, There are about 226,434 healthcare workers across both public and private sector, with 66, which is 149,447, serving in public facilities. Key cadres include 34,220 nurses, 4,651 medical officers, 7,877 clinical officers, 4,686 lab technicians, technologists, and 1,942 nutritionists. Additionally, 681 doctors from 41 counties are currently in postgraduate training to increase specialist capacity. At the community level, 107,831 community health workers, CHPs, support preventive and promotive healthcare. To support universal health coverage, UHC sustainability, the Council of Governors is advocating for Kenya shillings 7.8 billion in annual funding from the Ministry of Health to transition 8,287 UHC staff to county payrolls under the Salaries and Remuneration Commission approved terms. Over the past 8 months, 24.4 million Kenyans have been registered under the Social Health Insurance Authority, SHA, giving them access to free services at primary healthcare, PHC facilities. At the close of 2024, 9,365 public health facilities, which is 78%, had been empaneled. 594 more than under the National Health Insurance Fund. Public health facilities have received 12.7 billion out of the 35.66 billion disbursed under SHA, with the rest going to private, which is 48.8% and 15.6% for faith-based providers. Under the PHC fund, Kenya shillings 5.9 billion has been paid out, with 54% going to public health facilities. Despite improvements in fund disbursements, some PHC facilities are yet to receive payments despite submitting claims. Additionally, 1,544 licensed facilities still lack tablets needed for processing claims, prompting a call for the Ministry of Health to fast-track their distribution. The Facility Improvement Fund, FIF framework, has strengthened autonomy in public health facilities, enabling them to plan and manage their resources more effectively. Public facilities generated Kenya shillings 16.9 billion in revenue, reaching 91.3% of annual targets due to the strengthening of FIF framework. To build capacity, 1,510 healthcare workers in 10 counties have been trained on financial management, FIF implementation, and SHA optimization. These efforts are expected to improve service delivery and financial accountability in the health sector across county governments. During the recent period, the number of primary care networks, PCNs, have increased by 24%, from 151 to 227, with counties that operationalized them recording notable improvements in health indicators. 36 counties regularly paid stipends to CHPs, and 91% of all CHPs, which is 98,780, visited about 4.1 million households, reporting on key indicators and supporting SHA registration for informal sector workers. The Danida PHC program, public health care program, disbursed Kenya shillings 448.7 million to support level 2 and level 3 facilities and community level interventions, with 45 counties receiving on-site technical support. In terms of service coverage, respiratory illnesses accounted for 22.4% of all reported cases. Antenatal care coverage declined slightly to 53.82%, while skilled birth attendance remained high at 89%. Neonatal mortality improved, dropping from 10 to 9 deaths per 1,000 live births, and modern contraceptive prevalence held steady at 58.7%. County governments have advanced the health digitization agenda by receiving 8,316 tablets to support digital health information systems, patient registration, and claims processing. In oxygen infrastructure, there are 75 pressure swing absorptions, PSA plants in place, with 59 currently operational and 86 of public health facilities equipped with oxygen concentrators to maintain a steady oxygen supply. Following the expiry of the managed equipment service, the MES contract, the Ministry of Health and the COG launched the National Medical Equipment Support Project, the NESP. This initiative uses a fee-for-service model to deliver specialized medical services across all counties. So far, 541 facilities have been assessed for equipment placement. 28 counties have started offering services, and 29,669 services have been rendered under the NESP program. Despite these strides, service delivery has faced challenges due to delays in exchequer releases and shifts in donor funding. These disruptions have affected the stability of healthcare information systems, the management of essential health personnel, and the availability of critical commodities and vaccines. To sustain progress towards UHC, it is essential for the national government to release health funds in a timely manner, settle outstanding NHIF debts, and continue to invest in strengthening all aspects of the health system. Dear Kenyans, in the agricultural sector, in 2024, the agricultural sector remained central to the country's economy, contributing significantly to food security, income generation, and employment. The sector's gross value added, GVA, increased by 4.4% to Kenya shillings 1.71 trillion, though this was a slowdown compared to the previous year, where there was a 7.1% growth. Despite this lower pace, agriculture remained resilient and continued to be a major source of employment, creating over 308,000 new jobs, 14.1% being in the private sector, and 90% of those jobs are in the informal economy. Marketed agricultural earnings rose by 7.2% to Kenya shillings 690 billion, driven by strong performance in key value chains. Livestock earnings grew by 17.2%, while crop earnings rose by 2.7%. Notable gains were seen in sugarcane, which increased by 68.7%, milk deliveries by 12%, coffee exports by 48.6%, and avocado production by an increase of 34%. These were supported by initiatives like the bottom-up economic transformation agenda, better, which focused on those sectors. Investments in mechanization and livestock health increased, with the tractor fleet growing and livestock vaccinations nearly doubling. Artificial insemination services and milk cooling infrastructure saw major improvements as well. Additionally, infrastructure for the hay and grain storage expanded, and genetically improved initiatives. Genetic improvements initiatives such as chick and breeding stock distribution progressed as well. Farmer training and extension services were also significantly scaled up, with over 102,000 farmers trained and advisory coverage extending to over 6.5 million farmers, reflecting the strong county-led and county-level commitment to boosting agricultural capacity and resilience. However, challenges persist. Maize production declined slightly. Horticultural exports dropped by 14.1% in volume, resulting in Kenya shillings 20 billion income loss, and agricultural credit grew only marginally. The Agriculture Orientation Index also declined, indicating a need for better alignment between the government spending and the sector priorities. On arid and semi-arid land and disaster risk management, DRM, in 2024-2025 fiscal year, counties in Kenya experienced a marked reduction in disaster impacts compared to the previous year. Fatalities from disasters declined by 59%, injuries fell by 64%, and displacement camps decreased significantly. Infrastructure damage also declined. Affected schools dropped from 82%, damaged health facilities by 41%, and wash facility damages dropped by 87%. Agricultural losses were substantially minimized. A 97% decrease in destroyed crop acreage and a 59% reduction in livestock losses. The need for emergency relief diminished, with only 7,948 households assisted compared to over 51,000 the previous year, reflecting lower incidence of disasters. Institutional capacity for disaster risk management also improved. The number of counties with enacted DRM acts increased from 29 to 37, while those with DRM policies and emergency plans also grew. More counties allocated at least 2% of their budgets to emergency funds, and functional disaster management directorates rose to 43 out of the 47. Post-disaster livestock vaccinations also nearly doubled, indicating better preparedness and response. Moving forward, counties aim to strengthen enforcement of DRM laws, integrate risk management into their budgeting, operationalize early warning to early action using real-time data from the relevant agencies, and also improve fire departments' capacity through standardized equipment and inter-county procurement. Dear Kenyans, in the lands, housing, and urban development sector, county governments have made steady progress in spatial planning by preparing and approving various physical and land use development plans to shape urban and county growths. As of the reporting period, 19 counties had approved county spatial plans, with Muranga being the latest addition. 8 more have submitted their plans for approval, while 6 are in the early stages of analysis. These plans are designed to align spatial development with each county's broader development agenda and urban needs. In parallel, efforts to digitalize land records and processes have continued, with 5 more counties, Makueni, Homa Bay, Kitui, Narok, and Machakos, adopting the County Land Information Management claims system. Makueni County stands out for fully digitizing its land services into a single platform. The EU and Food and Agriculture Organization, FAO, funded Digital Land Governance Program, the DLGP, has supported the establishment of 39 fully functional geographic information GIS systems, labs, and trained 235 GIS officers and 141 county leaders in the application of GIS and remote sensing to promote informed, data-driven land management. Through the DLGP, counties have implemented 101 land governance activities, including clinics, training, and community outreach, reaching over 10,000 beneficiaries. The program also facilitated the training of physical and land use planning liaison officers and their committees, and supported the development of 16 land-related policies. This covers areas such as urban planning, housing, spatial planning, and land regularization. Additionally, the program helped create more green building guidelines, 7 legislative bills, and 2 research papers which are focused on planning status and gender-based land allocation in Nyamira County. During the year under review, 11 more municipalities received charters, bringing to the total of municipalities to 118, each establishing governance structures to manage urban services and infrastructure. County governments have also transferred specific functions to these cities and municipalities to improve efficiency and accountability in service delivery. In urban planning, there has been notable progress, with 64 out of the 77 assessed municipalities approving their spatial and physical land use plans, while 73 have completed integrated development programs and plans to guide local development efforts. In support of the National Affordable Housing Agenda under BETA, county governments partnered with the national government to launch affordable housing projects, contributing land and engaging in planning efforts. As part of implementing the Affordable Housing Act, 28 counties have set up county, rural, and urban affordable housing committees responsible for creating frameworks to guide the housing development, including a 5-year and annual investment programs aimed at expanding access to affordable housing at the county level. The Kenya Informal Settlements Improvement Program, KISIP, is active in 37 counties, with 88 settlements gaining security of tenure and 95 receiving upgraded infrastructure. 10 local physical and land use plans were also approved, bringing the total to 44 and achieving 55% of the program's target. This helped formalize settlements and prepare them for titling. In terms of socio-economic inclusion, 19 community development plans, CDPs, were completed and endorsed in Nairobi, Nakuru, Kisumu, and Kakamega counties, while also in phase 2, 19 community development plans were completed and endorsed. And in Nairobi, Nakuru, Kisumu, and Kakamega counties, while phase 2 of the CDP preparation is underway in Mombasa, Kiambu, and Uasin Gishu counties. Ladies and gentlemen, on transport and infrastructure and energy, county governments oversee 8,032 kilometers of the national road network, most of which consists of earth and gravel roads, with only 4% being tarmac roads. In the fiscal year 2024-2025, counties tarmacked 298 kilometers of road, constructed 4,800 kilometers of cabro roads, graveled nearly 12,000 kilometers, and added a further 1,949 kilometers of non-motorized transport pavements to improve pedestrian safety. To support public transport, counties have built 17 bus parks and over 16,000 boda sheds. Road safety efforts included forming 27 multi-agency county committees. Additionally, counties have strengthened technical capacity by hiring over 200 engineers, 900 traffic marshals, and bringing in 2,053 interns and attaches. County governments are running over 114 renewable energy projects, including the solar-powered streetlights, mini-grids, and hospital backups. Partnership with the Rural Electrification and Renewable Energy Corporation, REREC, through the Matching Fund Program, have also established in order to boost rural electrification. In 2024-2025, 16 counties have developed energy plans. 13 counties.
Well, live pictures there from the Council of Governors offices in Nairobi, and the one addressing is the Council of Governors chairperson, that is Ahmed Abdullahi, of course, giving an update or a brief on the 11th state of devolution in the country, as he gives just a brief on who's the largest share of this year's budget, that is Nairobi and Nakuru having the lion's share of this year's budget. That is a story that we are following closely. Now, Kip Kemboy is at the COG headquarters and will bring in us a brief of that whole state of the devolution in the country in our subsequent bulletins right here on KTN.